today we're going to be looking at the healthcare aspect of really caring for people in the sense of their healthcare and their well-being and quality of care and outcomes. And so just as a reminder to get us reoriented on this topic of employee engagement, Gallup defines it as people that are involved in, enthusiastic about, and committed to their workplace. So when we're talking about engagement, we're looking at that. And we're looking at it from 4 different kind of components of engagement in terms of how we're defining it. We're looking at it in terms of a sense of career. So do I have opportunities to learn, grow, and contribute? That's something that significantly contributes to engagement. When people do not feel like they have opportunities to grow, they're more likely to be looking elsewhere for a place to work. Another element is cause. So do I feel like I work for an organization that stands for more than just making money? We got to make money to pay people. Very important. That's essential. And if we don't feel like there's a sense of purpose or meaning outside of just getting a paycheck, especially now, people are more likely to be checked out. The third component is around a sense of community. Do I feel like I belong here? Do I feel like I fit in here? Do I feel like I'm valued? So that sense of community is essential. And we're really going to dig into that a bit more in our last session next week. And then the fourth element is around care. And so that might mean care in the sense that we talked about last week, like really caring for and about people in that human to human sense, but then also looking at this element of healthcare. And so what we'd love to do to get us started, to kick things off here and get your voices into the conversation, is just to tee up a sense of what's going to happen. So we'll do a couple of chats. So we'll have you interacting in the chat and sharing some thoughts. We did a breakout in the first session last week. We're going to be doing breakouts again next week, but this time, because there's so much to cover, and we know that so many of you are really eager to get these insights and have the opportunity for that Q&A time, we're going to be more so using the chat and Mentimeter for idea sharing and invite your voices periodically into the room, but we won't be using breakouts today. A couple of tips is keeping yourself muted. We will mute you if we notice that there's somebody who goes rogue and kind of unmutes themselves by accident. But we will do that just to optimize the experience for everybody else here. Again, be active in the chat. If you have a question, drop it in the chat. If something really resonates with you, drop it in the chat. Use your little emojis. If y'all want to click on the reactions at the bottom, if you can, you do the clapping, or if somebody says something you really like, you can press a heart or celebrate. It's just kind of fun to use tools like this in the midst of a session that is virtual. So to get started, what we would love to invite you to do is to think about for here, and I'll put on a little bit of music in here in just a moment. But before our first panel, what we would like to hear from you is to understand what's a new or enhanced benefit that you offered over the past 18 months that's been well received. So a lot of organizations have made changes to their benefit offerings. Perhaps, I know Claude mentioned several that VaynerMedia has implemented in terms of bundle for parenting, or I think it was Inner You, where they focus on some lifestyle and health coaching for people. There's different benefits that people have been implementing. And so we would love to hear from you of just to understand what it is that you've done. So we'll put on a little music, give you a moment to reflect on that. Let's see, we've got Robin says virtual healthcare and a digital pharmacy platform. Susie, student loan repayment. Thanks, Eric. Yeah, the student debt crisis is a for real thing right now. And so offering those student loan repayment benefits is significant. Ed, let's see, family planning benefits, infertility, adoption, and egg freezing. Diwana says legacy of love, prepaid funeral planning. Wow, especially in the past year, right? It's just been really hard to lose a loved one in the past year with all that's been going on. Offer a short and long-term disability income plan. Let's see, MSK vendor to lower MSLK costs. Maybe you'll tell us more about that if you want to unmute yourself and mention what that is, Keith, just for anyone that may not know the acronyms. Musculoskeletal, is that what that is?
Okay. Musculoskeletal, so it's trying to reduce costs for shoulder, hip, knee replacement, that kind of thing.
Perfect. That's what I figured. I was like, I think it's musculoskeletal. I just wanted to make sure for anyone that might not have the jargon.
and the ultimate thing is it's not MSLK, it's MSK.
Okay. That's all right. We clarified. We clarified it. So let's see. Courtney says pet insurance. Hey, Courtney. Keith, more freedom and flexibility to work the hours that suit you. Yeah, having those more flexible work hours and not kind of sticking people to the traditional 9 to 5 like we did when before COVID happened. Prosper Bridge. So Jervis says access to financial progress for everyone. Interesting. Let's see, Burt, tutor assistance for employees and their children. Yes, my husband's a teacher, and trust me, that is very much a needed thing. Andrew, increase communication over multiple platforms to stay engaged with employees on benefits and other company initiatives. Jay, skip the line insurance. You end up in a waiting line for any healthcare, you can go elsewhere. Is this a Canada only thing? That's a good question. Maybe someone can interject there. Kathy, platform to navigate all benefits through one app. Reward for cost of care utilization. All right, perfect. So we just wanted to kind of get y'all started in thinking about that topic of focusing on benefits and how you're caring for your people. And with that, I'm going to turn it over to Mr. Eric Silverman to get us teed up for our panel and get Keith introduced here.
Awesome. I'm looking forward to it. Keith, can you go ahead and introduce yourself? You are the man, the myth, the legend, the sponsor, the generous host of this Camp Engage 3-part series. So everybody thank Keith and Megan. Keith, tell us about yourself, my friend.
My name is Keith Lemer, CEO of WellNet Healthcare, third generation Washingtonian, and we lead a company that really builds and optimizes self-insured health plans for businesses and employees all over the nation. We've been doing it for about 25 years. And when I'm not working, I spend my time in the kitchen cooking. I'm a pseudo chef, and likely in my next life, that's where I may head. And so nice to be here. Thanks for organizing, and appreciate everybody, giving up an hour and a half or so of their time. Rachel, thanks for leading us, and Eric as our host, Megan, and everybody else. And look forward to bringing Burt on the panel in just a moment.
Absolutely. Speaking of Burt, Keith, did you want to do us the favor of introducing your friend Burt?
Sure. So we are joined by Burt Brenner, the CFO of Lindsay Automotive. Lindsay is, I'd say, one of the largest automotive dealers in the nation. They have about 14 brands, everything that you all know and trust, from Volkswagen, Chevy, Honda, even Harley Davidson, body shops. But what they're really known for is a culture of health. And Burt's going to spend some time talking about that. Burt is, I guess you could say, kind of the king of cars when it comes to managing money and, taking care of finances for all of his associates, around the Washington region. They have dealerships in Northern Virginia, Maryland, and these guys have been doing this since, Burt, if I'm not mistaken, 1963. And a fun fact about Burt and the organization that he's with is they are the largest player in the aftermarket Volkswagen Bug space. So if you all have seen, the Beetle, right, that's very popular from the moment it came out. They are, if I'm not mistaken, Volkswagen does not make them anymore. And Burt and his team have now been collecting and buying them all over the country. And they are the largest seller of Volkswagen Beetles. Burt, anything to add on top of that you'd like to share?
No, it's great to be here. I'm a yellow banana guy, so you are my people.
That's my man. And with that is a perfect segue. Nice to meet you again, Burt. Thanks, Keith, for bringing him on. Burt, I'm also from the DC area, originally born and raised on the Maryland side, but know your area very well. So, Burt, if you don't mind, let me kick it off to you. Can you tell us a little bit about your start of your journey in general? What happened in the organization to spark a need for change with respect to healthcare and so forth, and the way you structure your culture? And really, can you tell us about your employees and the nature of your business, and kind of dig into some of the challenges you faced and how the employees were impacted?
Sure. So the journey started when we went through a pretty heavy growth phase, and realized just how little control we had on health costs. And what we were looking for was more transparency. And our employees, we have about 1,000 employees, and they're exactly what you would expect them to be in the car business. Technicians, salespeople, parts advisors, admin, body shop personnel, all over the page in terms of not just, income, nationality, just all different levels of people. I mean, that's the great thing about where we are in Northern Virginia, DC. It's just a great melting pot. Our main concern really was the lower end folks, because, we've all been there with healthcare. It's 25% this year, it's 5% the next, it's 40% the next. And you don't know until it's too late, right? You get your renewal and then you're struggling to try and get out there and make sense of it all. So what we wanted to do was bring more of that control back in-house and create some stability in pricing, certainly for the company, but more specifically for the employees.
So how is the business specifically challenged in general? If you can elaborate on that a little bit.
Well, we have high turnover. It's typical in any sort of retail environment. It's typical in the sales department. So, we're turning over 300 to 400 people a year, which is a crazy number outside of the car business, but actually quite low within it. So, for us, that's one of the bigger concerns. And then you have, a mix of people who are sort of entry level, who are kind of, the people you want on the plan, single, don't really need insurance, but they kind of help balance things out. And then you have a huge portion of family folks, and you need them both to make it work, to keep the balance.
And so, Burt, tell me this: what made you all decide to go self-insured, having been fully insured for all those years prior?
We had the timing was right. We had gone through, like I said, a huge growth phase. We got to the point where self-insured was an option, and I know that that number keeps coming down. At the time it was 400 bodies, and we just wanted to have more control over what an employee, their not only what they pay, their level of service, and also the structure of the plan. Medical plans are not one size fits all, and that's the way the fully insured market presents it to us. And we just didn't feel the cookie cutter approach would work for us, and so we started exploring and found some really nice options with WellNet. And, we had kind of a rough start in the beginning, but it really wasn't anything to do with the insurance itself or WellNet. It was just heavy claims in that very first year. And that just sort of solidified our decision in making the move, because we knew the higher the claims, the more real control and transparency that we needed.
How's what's the employee response been? Was it most times I hear that when you move self-funded, the employee experience isn't much different. If anything, it's better. So ultimately you're trying to make it smooth and very little disruption to the employee themselves. Yeah.
So, we didn't use it as a time to change benefits. We kept deductibles the same. Overall coverage was still the same. It was a very rich plan. What we needed to do was bring it in, figure out where we stood, and in the same time kind of re-educate employees on, the state of health insurance today, not what it was 20 years ago when, it was, the $50 a week or whatever it was that came out of your paycheck, and that was it. Those days are gone. So, we kept the benefits the same, and the response was great. And actually, as the years have gone, I think, Keith, I can't remember, but we're in year 5 or 6, just to give you an idea. Our first year renewals were kind of what we expected based on claims, and it's been declining ever since. Last year, we had a flat renewal, a 0% renewal. This year, we've actually not only cut the rates for the employees by 5%, but we have about $700,000 that we're pocketing in the event that we have a high claim year that we can use to stable out future claims. So again, it's the health insurance is such a major benefit. And, we're in an environment that it's gotten so difficult for people to afford it. And
Bert, you're an analytical guy, right?
I am
a tactical guy.
So. Yeah.
And about culture. What excites you about what you're doing with the health plan now?
The great thing about it is, right away you get nearly real-time reporting. And so you can see the trends as they're happening. And what that allows you to do is you can make decisions on the fly, or you can kind of put notes in and say, gosh, this is what I want to do at next year's renewal. And I'll give you an example of that. So we had a couple of folks that were on dialysis. And, traditional plans, whether you realize it or not, is they can kind of go anywhere within, as long as it's a provider that's in the plan. What we did is we created a separate agreement with a dialysis center that has plenty of centers around the area. And we were able to cut costs on just 2 participants in the first year by $700,000, $689,000 and some change. So, you talk about seeing things as they happen, adapting, and then seeing the results of it. And honestly, that I have to give that credit to Kathleen and WellNet by, bringing this concept to us, going to market, and making it happen. So really it's all about, here's the data in front of you. How can we cut costs here without cutting benefits? It's all about the best value, right? That's what we all want with insurance, and anything we buy is the best value. And I feel like now we're in a position that we're able to provide that to our employees. So I feel much better about it, and I'm not holding my breath at renewal. Because we've all been there, going back and trying to, 40% increase, and it's not possible in today's world. So
sounds even more exciting than selling cars, almost, right?
Well, yeah. I mean, I love the car business, but I must admit I've never been in the sales side of it myself. I've always been more on the admin side. I'm kind of a behind the scenes guy.
Let me switch gears for a second, Burt, give you a chance to grab a sip of coffee or water or whatever you prefer. And Keith, I want to switch gears and ask you a question, if you don't mind. What are the most common areas businesses like Lindsay need to tackle first when it comes to improving care for better outcomes? And really, how does communication and navigation support it?
I'd say 2 items really come down to it. First, and Burt touched on this a little bit, was about owning your data, owning your plan. It really doesn't matter what size group you are. I'd say 50 or 75 employees and above, but to be self-insured allows you the visibility and the understanding of what's going on inside your plan. If you remain fully insured, it's like a black box and you're rolling the dice each year. Those increases that Burt touched on earlier, I mean, they are running rampant. And now, you're seeing the outcome, right? Unaffordable healthcare mess all over the nation for businesses, for employees, for their families. And so when you do have that data, right, you can now do things to make changes and communicate. And the biggest item, that second point that I wanted to share, is it's education, education, education. Most employees, and no matter really the sophistication level of those employees, really don't understand how health insurance works, how you can actually get higher quality care at lower cost. Most of the time, right, people are going to a physician that someone recommends, even if they need a procedure, right, a surgery, they're going to who their doctor may have recommended. But that doctor, right, that knee surgeon or that wrist surgeon may not be the best surgeon to do that procedure, right? And so having the ability to have choice and flexibility, and really to use that education process with advocacy, and really advocates that are there to answer questions, that are there to guide and advise. Not only are you winding up getting better care, but you're saving a heck of a lot of money for yourself and certainly for your employer, because consider the alternative, right? If Burt and Lindsay's costs kept going up year after year, they'd have no choice but to raise the copays, increase the deductibles, because there's no way they can afford, any business, like Lindsay, to suck back those continued increases. So, it's about data control and education.
Man, I couldn't agree more. I mean, you talk about asking around, and your doctor can refer you, but steering them to the right place to get the right service at the best optimal price point is so key. I mean, my gosh, how many of us on this today, there's more than 50 of us, have scrolled Facebook feeds and seen somebody ask for, hey, I'm looking for a plumber or an electrician or a hairstylist. And that's great. That works. But I cringe when I see the ones when somebody's like, hey, my grandmother needs a knee replacement. Who's a good doctor that did one for you? Oh, doesn't everybody, am I the only one? Like, come on, this is craziness. We're talking about medical stuff here. So anyway, I digress. Burt, let me throw it back to you with a different question. What are some of the early wins and successes that you saw when making changes to your health plan? How did the employees respond? And how did the changes help their families?
Well, obviously, the cost part is a big part for employees, but they don't want a reduction in care either. So the main concern was, okay, I'm getting this for, a better price or a similar price under a different plan. But how does that translate to the actual benefit? And, the thing that I love about it is they've all been very pleased with both sides of it. The main thing I will say about going to a self-insured plan, and the main thing besides the cost component that really is a huge win for anybody who's on it, is the stability. It's not just the stability in the cost, it's the stability in the provider, it's the stability in the networks. It's, we went through years where we would have a different company every year, and then 2 months in, everybody's still waiting for their new cards, and then you got all these backlog of claims, and the stability translates down and pushes down to less negative activity in your HR department and things of that nature too. And it also helps with your image, right? You have great benefits. If you're known for great benefits, people in all these markets talk. I don't care what market you're in, the employees under you are talking to somebody who's in one of your competitors' markets about all kinds of things, whether it's, health increases, raises, other benefits. That stuff is happening, whether you know it or not. And, it's just created a better, image brand for us, which we really work hard for. We started as a very small family company, and we're a fairly large player now, but we also want the family element. And this has really helped us get back there on the health side. And early wins, reporting, transparency, some of the things I've already mentioned.
Yeah, and to tack on to that, I mean, Burt is really in the community. They are known as the employer of choice, right? And he's not just competing with another auto dealer a mile away or 5 miles away. He's competing for talent with the federal government, with Amazon, right, and all these other employers. And so being known as the employer of choice that not just, pays well, but provides high quality benefits, right, at lower cost, where, members can get deductibles waived when they make better choices, when they pick up the phone and they use advocates that are going to steer them to maybe get, prescriptions waived, as an example, a cost that would normally go on Burt's plan. I think if I look back last year, there was $500,000 that Lindsay didn't have to pay because we were able to actually get about 4 drugs over the course of a number of members for the entire year, picked up by the pharmacy manufacturer. That was almost $500,000 in savings. I mean, massive amount of money. And the traditional insurance company, and again, whether you're with those guys on a fully insured basis and even self-funded, they're never going to do that kind of legwork, right? And so that engagement, right? Every time when I see a message in the chat box from John Augustine, he says, every time, that somebody calls about healthcare, whether it's member services or other, it's a touch point to educate that member, right? To communicate on the value of the plan, to share why it really and what it means to be engaged, right? Because most employees, typically, they don't have $1,000 in the bank. How are they going to pay for a deductible of which some companies, have it set at $1,500 or $2,500? What they'll do is they'll put off care. And so Burt has attacked the problem in the right way, really, I would say, looking at it as another business unit.
Yeah.
Agreed. I mean, it's for us, it's a $7 million a year expense. Obviously, employees share in some of that, but 1% is a huge amount in itself. So 40%, 30%, gosh, that's just crazy.
My brother's been selling cars in the car business for the better part of the last 15, 20 years. And he's told me many times, and he's switched dealers a few times, and salespeople do that all the time. The car business is not very known for having the most employee-centered and centric focused benefits and culture. So by all means, your turnover, as high as a lot of people may think it is, I know for a fact, for a certainty, like you said, it is lowest or lower on the lower spectrum to what the car industry as a whole has. And obviously it's attributed to many things, one of which certainly being benefits. I have a question for both of you, Keith and Burt. So you guys, whoever wants to chime in first, but I would be curious to get both of your opinions if you don't mind. So how can company leadership take a vested interest in helping employees understand their health plan? Think about it based on how conditioned C-suite executives like yourself, CEOs, CFOs, how conditioned you are that healthcare is a high cost of doing business. How do you get the employees to believe the employers to believe they can save more and get better access to care? So I'll leave it at that, and I have a follow-up after. But can anybody talk about that for a moment?
Burt, you want to take that first?
Sure. There's obviously different options and plans. So, they can always, take what they save on the plan, put it in HSA or something like that. We tend to have a lot of transparency in much of what we do. And what I mean by that is we let employees know what things cost and that we're self-insured and that they're part of this big picture so that they understand, going to the doctor for something that they really don't need to, that they could do in a telecall, or when they're considering going to one hospital versus another and getting back to that knee replacement. By the way, this one's $300,000 more than this other one, which is 5 blocks away. That makes absolutely no sense to any of us, but it happens every day. So for us, it's about kind of bringing them into it and, making them feel like they are part of all of this, because they are. Higher claims will lead to increased rates for them. Lower claims will lead to lower rates, and we've proven that. And so for us, we'll just continue to go down that route. We'll still have kind of the campfire stuff. We have a broker that comes and visits each store personally and allows people to call directly, and all brokers will do that if you find the right ones. So that's kind of how we do it. I hope that answers your question.
I'd add, and I think Burt hit the nail on the head, right? It's about education to the employees, and Burt is really, and what we've seen with him and many of our other customers is it's a partnership, right, between them as the employer, the employees and their families, and also the broker who's actively involved, right? It allows the broker, frankly, more face time, who traditionally, when working with a customer, doesn't get as much face time. Now they have data to, talk about challenges and talk about opportunities, but it really comes down to communicating with the member, right? Not just at open enrollment, but on an ongoing basis, both in person or now Zoom and, regular email communication, or we actually implemented a text platform as well, where we can get cell phone numbers. And so it's that ongoing level of access to the member, so they understand. And, as everybody here knows, right, you're an employee of a company. People are smart, right? The more information you have, the more ability you have to make better decisions for you, your family, and certainly your employer, because, again, the employer's costs continue to go up. Well, those costs will in some way come back to the employee. And so if everybody does their job, right, and becomes smarter consumers, right, people spend more time, buying a vacuum cleaner and analyzing the cost of a TV than they do, the biggest decision of their life, right, a heart surgery or knee surgery or a regular physician visit. And so it's really about a culture of change. And that culture of change really starts with education.
I want to make sure we have plenty of time. We have a number of questions. We could go on for days, but I want to get to a lot of the questions within the group here today. But one last question before we open it up to the group, I'm going to skip over here to for you, Burt. Is can you really just summarize the overall success from company cost savings to employee health and happiness and productivity? Is there a way to summarize that as far as overall success?
I mean, that's a good question. I don't know if I could summarize it in any way that I haven't already stated.
Okay.
But one thing I will say that I didn't mention is we are not a young group. We're not an old group. We're somewhere in the middle. We have plenty of heavy claims. So I don't want people who think, oh, we have this guy on our plan and I know he's that self-insured is not an option. Honestly, it's a better option. Because again, you have more control, and there's so many little elements within health insurance that we have zero control over in a traditional plan. And, a self-insured plan allows you to make it fit you, make it fit your employee base, make it fit your age base, and make it successful for you. Again, it's not a one size fits all. So I think, really just engaging in the process and realizing that there is opportunity is the first start. You're not captive to a fully insured provider.
Awesome.
Which is kind of how I thought about it for many years. It's like I didn't have any options. And I can tell you, you have a lot of options.
Yeah, self-funding is really, it's a journey, right? And everybody's pace for that journey, some want fast and some want, moderate, but you're able to go based on the information and the insight that you have and understanding your particular culture of your employees. And so, depending on what that information says and how the members actually receive that, you can save as much or as little as you desire, but it allows you to kind of create that roadmap for you. I mean, and that's the beauty of what we've seen at Lindsay. I mean, even looking at, opportunities where they've gone in and, done a bundled contract pricing, I think in the fourth or fifth year where the member still was able to go to Johns Hopkins and Burt was able to pocket $150,000 than he traditionally, or shall I say, he would have been out of pocket an extra 150. So, it's doing things like that. Data tells a story. And so, the more you have it, the better you're able to, manage and measure.
So Rachel and Megan, can we open it up to some questions from everybody? And real quick in the chat, I see Gail Hilder Lee, Michael Ramon, Patrick Hood. You guys had some really brilliant questions. If you don't mind, maybe you can chime in, raise your hand and unmute yourself one at a time. We'll call on you. We'd love to have you come to the stage and chat directly here with Burt Brenner and Keith here from WellNet. So I'll kick it off though, real quick. What would you guys advise other CFOs and brokers on the call today? Very open-ended.
Yeah, it is. I mean, I think just getting back to my last statement that you have more options than you think. And, you may have a broker that's been traditionally pushing you towards fully insured because it's easier for them. And, you know, just know that that might not be in your best interest.
Okay.
And, you know, another thing is you can negotiate your rates with your broker a lot easier on a self-insured plan. Everything is more flexible.
Absolutely. Got a question, and I saw your comment, Gail. Don't worry about it at all. I'll ask your question in just a moment. It's a fantastic question. Rosario, you have your hand raised. Can you ask do you have a question or a comment?
Yes, a question for Burt. Thank you for being on this and sharing so much with us. But I know that the automotive industry has massive turnover. How do you handle the turnover and recruitment in that industry?
You mean just in general?
Mhm.
It's really difficult. So we basically have training classes going for new salespeople every week of every month of every year. You know, you're not getting the traditional. In the old days, people would just bounce from one store to another. You're getting a new generation of folks now, and I think, you know, the stigma that once was on the car business has been reduced some, and we're still working towards getting that better. You know, you guys on this call will be happy to know in a few years you'll be able to buy cars anywhere you go, you know, fully electronic. But yeah, for staffing, it really starts with reputation. And then when you have reputation, you know, we have ads out all the time, usually on Zip or you know, some of the others. And then we run people through a class. Sometimes some survive and some don't. And then we place them based on where we believe their expertise is and where we believe and honestly where they live, because we have stores that are you know, 80 miles apart, so we have to, you know, be careful in that regard. So honestly, it's just constant training. I wish I had some real good insight for you about, you know, gosh, we've been really lucky going here, but it's really just a volume-based approach. You know, get as many people in the room. We have basically 3 full-time trainers that run classes all the time.
Good.
And usually by the end of the first week, they've dropped off, you know, 20-30%. You might lose another 10% the next week. The rest of them, they stay, they go through a 2-week additional training session if they've never sold cars before, and then they're selling. So our turnover though is really very low in all other departments. So that helps, right? We have tremendous processes on all other aspects. Well, in sales too, but we have very, very little turnover, less than 5% in any other departments within our organization.
Yeah, I find it is always segmented, particularly with a large organization. Depends on the department for sure. Great question, Rosario. Thank you. And thank you, Burt. We have time for a few more questions. Michael, Ramon, can you unmute yourself and ask your question? I thought it was great.
Yeah, absolutely. Glad to be here today. Burt, my question would be, annually, as you approach the open enrollment period and when you decided to move to WellNet, how did you go about educating everyone and handling elections that are made during the open enrollment period, not only for your health insurance, but for any of the other benefits that you may offer?
Well, the first thing you got to do is you got to start earlier, right? So we thought we wanted to make a change in the future. So in our prior year enrollment, we kind of set the table with that. You know, we're looking at making changes that'll help stabilize all this in the future. And then from there, and, you know, instead of, you really are going to have to push your carrier, and you might not even have all the information at the time. But that's okay. You know, you can kind of anticipate where you are, because, you know, what they do is they'll hold back until there's really not enough time for you to make a change, right? That's their move. But you don't have to accept that. So you got to start at least, I'd say, 4 months ahead of time. And, you know, bring in a broker or do some Zoom, bring in your broker and start doing some minor education and get people teed up for it, and let them understand why you're doing it and how it will benefit them. And it seems like a massive project, thinking of it where my head was before we went on to it. Quite frankly, it was a lot easier than I thought. And gosh, the renewals now they're so easy. I mean, it's just, I can't even tell you how simple it is. I don't know if that answered your question, but if you have something more specific I didn't answer, feel free to add.
I think the only clarification I would look for is, do you do it through a Ben admin system and electronically? And if so, when did you implement that to get away from the paper process?
Well, we do our enrollments through that, but the actual election we still do on paper. So what happens is, and part of that is just because so much of our population is English as second language or non-English speaking. You have a lot of technicians, people turning wrenches who they just don't understand. And there's so many languages here that there's not enough forms that the insurance companies could provide to give you that. So what we have to do is kind of collect that via paper. And then from there, it becomes electronic through our HR department. But really, it's just year one that was the struggle. What you find is most people, if rates are staying the same or even going down, they're not making a switch. So the enrollment is simply become, sign this form that you want to keep everything the same. And, they check the box, and then if we collect the forms and boom. So I would like to get to more automated process. I just don't know if it will work 100% in our industry. It would probably work for about 50% of our population, maybe 70. Maybe you would have more luck with it based on your industry and where you are. But for us, it's just not an option to go fully automated.
Yeah, and Michael, Dad, we've bolted on a Ben admin system that we've custom created for our customers, so making it easy for them to upload, add, terminate, et cetera, on an ongoing basis.
Yeah, I mean, our HR folks love it. So it's easy to add, it's easy to subtract. It's billing's easy. We have tons of different locations. We have one consolidated bill. We've got it down.
We thank you, fellas, for answering that question. Michael, great question. Let me move on. Patrick had a good question. He said, do you have any employees on Medicare? If so, how do you address these people? And Burt, you did say you have an older population, so I suspect this does come up.
That's a great question, and actually something I wanted to talk about earlier. So, your aging population is obviously your highest risk. And so what we did with the help of our broker is we had anybody who was eligible for Medicare meet directly with the broker, explain to him or them how the plan works. And basically, if the history of Medicare doesn't have a good reputation, right? Now, Medicare is better than most plans you can find out there. It's a richer plan, it's lower deductibles, it's lower cost. And so what we did for those employees is we set them up with the broker. You can't force anything, but you can incentivize. So we set them up with our broker. After we explained it all and helped with the paperwork of the transition to Medicare, you're taking all those high-risk people off the plan, but you're also doing that, giving them a plan that's as good or better with lower costs. And then on top of that, we incentivize them with I think it's $400 or $450 a month, which is basically what we would give to any, single level employee to help offset. So for them, they're actually saving money going to Medicare. Everybody's afraid of it at first, but I can't tell you how much that's helped our plan. Because you get a couple folks, over 65, 70 that have, $1 million, $1.5 million claims. It can really hurt you. Not just on self-insured, but fully insured when you get to your renewal. So to me, That's like step one. If I were looking for a way to save money on our plan, that's it.
Yeah, the ability, by the way, Eric, we've seen, many groups right off the bat, they can take 5 to 30 people and suggest they move to Medicare, right? Terrific marketplace plans. And, when you're looking at cost anywhere from $10,000 to $40,000, sometimes these seniors use, that's a massive savings, as Burt mentioned.
So got time, I'm sure. I think we do. Rachel, do we have time for a couple more questions? They just keep coming in here. Gail Hiller Lee asked a great question. She said she's a little bit shy, so no worries, Gail. If you don't mind, I'm going to ask this for you. And I'm not sure if it's directed toward Burt or Keith or both, so either of you tackle it. But and if I mess this up, I'm not a health broker. I'm a broker's broker. I'm on the other side of the health industry. So the question reads as a group that has about 250 people with fluctuating claims from 49% loss ratio to 165% on a monthly basis, how can a self-insured plan with 0 laser claims come out to save money when a negotiated, capped, fully funded might have to pick up all the additional costs in a year? That's the way it was worded.
I would answer this question one way, and Burt may have another response, but it really comes down to, right, when you control the cost of the claim, you control the cost of the premium. And right now there is 0 controlling the cost of the claim in a fully insured plan. When you are self-funded, right, you have the ability to get a knee surgery for 15 or 20,000 versus $80,000 down the road, or a back procedure, right, that might cost $170,000, in Burt's region at MedStar Health, and then maybe down the road 17,000, someplace else. But having that ability to understand that you can, have that choice, have that flexibility, and see different providers, really, because you want to. A, you want a better outcome, and B, you're looking to save money. So in a fully insured plan, you will see those wild swings, because right now people, it's like a buffet, and everybody's got an open-ended credit card, right? They stay at the Ritz-Carlton, they have filet mignon every night, and that's not working, right? And so the more information you give people, right, the more ability you have to control that most basic item, right? Control the claim, you control the premium, and thus reducing the wild swing.
Yeah,
Burt, would you add anything?
Yeah, I do. So that's a great question. And I can see how, just in the way it was asked, I could see how stressed the individual is about it. And it is a stressful situation to be in. I will tell you that there is light at the end. I'll give you an example. We had an employee who had a child who was getting blood transfusions to the cost of about $60,000 a month. That was in a fully insured plan. We had 0 control over it. And we would get those spikes, some months you'd see 3 months worth of those expenses come through, because that's how people, get their medicine these days, right? And 90-day supplies. When we moved to self-insured, it was a lot easier than I thought it would be. Those costs are still expensive. And we were able to manage it with the employee and in a contract like we had with the dialysis that I mentioned, for under $10,000 a month. So again, it comes back to that control. You look at it and you're like, how am I ever going to go over this hill? And you have to be willing to make that commitment. I guarantee you that you're not going to spend more on a self-insured than a fully. You're just not. The first year you might spend the same or around the same, maybe even a little more. But I can tell you, after you get a hold of it, you'll see it start to trickle down. And then the good thing is that lasts for as long as you want it to last, right? We could go back to the fully insured market at any time. That's not in the cards for us. It's just not. I wouldn't.
So guys, we have just a way in a good way. I'm not complaining. We have a lot of questions that have come in. We are out of time. We have a lot more content over the next 35 minutes that we're excited for the 50 or so folks on here to participate in. So please don't leave. Burt, I want to thank you so very much for being a part of our camp day 2. You didn't know you were going to spring camp, did you?
I did not.
Which was baseball spring camp. And Keith, as always, of course, appreciate you as well and everybody else. I'm going to throw it back over to the hostess with the mostest, Rachel Druckenmiller. Rachel, what's on deck?
Burt, thank you, by the way. You were fantastic.
Yeah, thanks, everybody. I hope I was able to provide a nugget here and there for somebody.
You were great. Thank you. Enjoy tax day.
Thanks, bud.
Awesome. And speaking of which, let's drop into the chat. And if you could drop in there the greatest gift or insight that Burt or Keith gave me was, we say the greatest gift they gave me, greatest insight, the way they made me think. And also if you see a question in the chat that you have a response to, you can always at that person. So for instance, if there's a question that Jervis asked and you're like, I have an answer for Jervis, you can write directly to somebody, or you could just say, hey, at Jervis, here's a thought for you to consider. And so feel free to talk to each other in the chat. And respond to each other that way. So we'd love to hear, what was your biggest insight? Loved, if you control the claim, you control the cost. Thank you. That was awesome, Burt. Okay, if there's anything else that comes to mind for you, feel free to drop it in as something that was an insight. Otherwise, what we're going to do is we're going to transition into doing a panel with all the folks that have been involved in planning and pulling this together. And we're going to kind of shift and expand the conversation a bit here to just kind of supplement what's already been shared. So we're going to bring the rest of the crew up on stage. And just a super quick, let's see, Patrick says the ability to have more transparency and faster data. Yeah, it's possible in ways that it wasn't necessarily before, right? So perfect, we'll bring Andrew up there. Excellent. All right. So what I'm going to do now, and we're going to do this very, very quickly. I know some of you met us before, but in case anybody wasn't with us in the first session, we're just going to do a very quick round robin and just introduce ourselves in about 30 seconds or less and why we're happy to be part of this conversation. Then we'll go into some questions from Megan. So Ed, kick us off.
Hey everyone, representing the West Coast here again. Just excited. I mean, first of all, Burt and Keith, that was amazing, and so glad you're hanging out for the rest of this. I'm even learning a ton here too, so I just want to say thanks for allowing me to be here.
Perfect. All right. There you go, Ed. Quick news. There we go. Eric, coming back to you, just real quick.
My name is Eric Silverman, and I am the world's largest Baltimore Orioles fan. That's it.
That's it. Cool. Thanks, Eric. All right. Going back to the Bay Area. Rosario and Andrew.
Rosario.
Rosario Avila here from Wine Country, Sonoma. Great to see everybody again, and great to be on this cast here.
All right.
And Andrew McNeil, also from the Wine Country. We're really passionate about employee engagement, talking about different ways that an employer and a broker can advise their clients on how best to engage the workforce. Being out in this area, we have a different way of doing things outside of what Keith and Burt were talking about. So we're excited to talk about that.
Fantastic. And then just a reminder, I'm Rachel Druckenmiller, and this is what I do for a living. I spend all day on Zoom with different groups of people or different events, facilitating engagement. So I've delivered almost 150 virtual workshops, keynotes, presentations, and trainings over the past year, and used different tools for how to foster engagement, connection, and meaningful conversation in a way that really helps to unlock people and to connect people. And I spent the first 13 years of my career working for a benefits broker, working for a Lemmer group. So that's kind of my tie-in and connection to the benefits space here. So we are going to go right into this questioning. So Megan, if you want to kick us off, and if anyone has any questions, feel free to drop in the chat. If we can get to them, we will.
All right. Let's do this. Is the panel ready? Yeah. Okay. I'm probably the only one that gets this excited about benefits. All right. So this question we have to the group, and I want to pivot to maybe Eric, Andrew, and Rosario. I think this is a good question for you all, just knowing your experience in the space. how can we customize an employee benefit package to be all encompassing? Like, what are some success stories? What are some tips? Let's give some tangible nuggets here for our amazing attendees.
I'll start. So I would first start the conversation with the employers. What is it that you're looking for in an employee? Because building a benefits program for the employees you want to attract and retain. I saw somebody in the chat earlier mention the labor market and the talent war has never been this intense. And so building something that the people you are trying to attract is where companies should focus. We're doing a lot of things like text messages, video platforms as a way to help those employers communicate with their employees, not just communicate the information that they're providing to them, but also get feedback from the employees to find out what it is they actually want, so they can build something as a collective group that works for everyone, not just for what the employer or what the broker thinks.
Love it.
To add to that, something that Keith had mentioned earlier is, partnership. And I think it's a key for the broker to have a partnership with the company, because that's the way to personalize benefits, personalize the engagement, personalize the communication, is getting to know the company. You can have many companies in the same industry, but each one is going to have a different culture, and each one's going to have a different.
Yeah.
Oh, no, I think we lost her.
They don't have internet in the Bay Area. It's Silicon Valley, but it doesn't exist.
Andrew, do you want to finish her thought? Because I feel like you guys are so in sync.
Yeah. So talking about, not just the culture of an organization, that's I think where she was going with it, the culture of an organization, but you have different cultures within it, and how best to communicate with each culture. Because the information that I receive as a millennial is not going to be the information that a Gen Xer or a baby boomer gets, even though we've been given the same information. So we talk a lot about persona-based education and being able to communicate with each generation or with each culture that you have at your place of business, which greatly impacts the engagement you get with that group of people. It's interesting. It takes a longer time to do it, but once you figure out how to do it, you can streamline it, and people are much happier. We've had several situations where we've done certain things, either communicated through text message or, like I said earlier, through video, or instead of like Rosario's piece, normally when you have a group of people that's English as a second language, a lot of people think, and it's no cut against them, but a lot of people think that because you are translating it into their language, the box is checked, you can move on. You don't have to do anything else.
Yeah.
But what's really important, what I've learned, especially hanging out with Rosario the past few years, is it's not the linguistic translation, it's the cultural translation that you really need to focus on. And so for anybody that has a different culture in their organization, really suggest trying to hone in on what that is.
Bingo. And guys, I'll add, I know we have a bunch of questions to get to, Megan, but I would add one pro tip that we do with all of our large and small accounts, quite frankly, even very small accounts that we help our broker client partners with is communication's key, but zero in on what the employees actually want. And I do not mean a survey. A lot of executives and HR folks will send out a random survey, a Survey Monkey or a paper survey, and they're hoping and praying they get 10 or 15% return, meaning they turn in the actual survey results. I would suggest actually taking it a step further. Megan knows I'm a big believer in focus groups. They are incredible and amazing. When's the last time you had your employer group, if you're a broker or if you're an employer or HR person on this phone, when's the last time you actually did consistently, even monthly focus groups with different key people from all over your organization? So you bring in 1 or 2 people from accounting, 1 or 2 people from sales, 1 or 2 people from marketing, 1 or 2 people from the custodial staff. Again, depending on the industry, pull in somebody from every department, buy them breakfast or lunch. They'll get excited to come aboard, and let it be an open forum where you ask them questions and you get real insight and feedback which will allow you to garner and gauge where you want to take your benefits in the future. We did that with a 3,400 life case in Indiana with my broker partner. And the feedback we got, guys, was absolutely mind-blowing, because the C-suite thought immediately in the beginning that the conversations were going to go very different, but it really zoned in a safe space and showed what was on the employee's mind, what their challenges were, what they're dealing with, what their conflicts are, and also really zoned in on where they should go with their employee benefits.
Yeah, I think that's a great tip. I think always analyzing, reevaluating, surveying strategically, like you can't go wrong. There's no lose in that, with getting honest feedback. So I love it. I absolutely love it. All right, let's shift gears. I know we have another great question. And so this one, I want to punt to Ed, Rachel, and even Keith, if you want to chime in too. I think this is in your wheelhouse. So I'm going to say the scary word in the benefits industry: wellness. Wellness can be so vague, right? Guys, how do we focus? How do you focus on this for an employer to improve outcomes? I'd love to hear, I know the group would love to hear like a success story, or even a case in which, you took a deeper dive into the health plan to lower the cost curve, to improve wellness. What is wellness today for the benefits experience and better outcomes?
Rachel, you mind if I hit on a touch of a response there?
Sure.
I really think that wellness in a fully insured environment really does not have any teeth in it, right? It's soft, it sounds good, but you're not going to see any real results, both I think economically and very little any other matter in terms of health improvement. When you're self-insured, right, you have the opportunity to put incentives in place and to advocate and to incentivize. I mean, do all of those things, including, recognizing, high risk population, moderate risk population, catching people earlier, allowing them to use tools that can engage them, gamification, all of those kinds of things. But those things truthfully only make sense, again, when they have teeth in them. So a lot of these wellness programs that are out there, I haven't seen a whole lot of results. There's others out there, right? They call these programs, pardon me, BS. I tend to agree with them unless there really is, dollars tied to it that you can actually see tangible results. And so, Burt was on here before, right? They do have a wellness program in there, but again, they're self-insured. They have incentives in place for their members. They have programs that they're running for, employees to do steps for, all other kinds of, eating healthy and those kinds of things. But those only make sense, right, when you're controlling your plan.
Well said. And then Ed, why don't you weigh in, and then we'll have Rachel round it out.
Yeah, I think you kind of hit the nail on the head with it being such a scary word in our industry now. In the early parts of my career, I found wellness to, when you fast forward to today, it's become pretty gimmicky to Keith's point, where, you hang a smoking sign up, or, no non-smoking sign up, or tobacco cessation programs, or things of that nature. It's now, at least in our market, has become a little bit a gimmicky. And so what we've realized that it really comes down to, knowing your audience, and you really can't control what you can't see at the end of the day. I think, there's so many different ways you can kind of go with the word wellness, because it is indeed vague, but, to us, we want to help the employers understand what wellness means to them. There's a point made earlier about creating a benefit program that makes sense to the population you're trying to attract and retain. And so with that in mind, again, you can't control what you can't see. So take a look at your demographics, take a look at the multi-generational workforce that we have within your population today. Figure out what are the things that make them tick. Going through pandemic over the last year has brought a lot of things to light in two different ways for me. One is getting to understand what are all the different, generations and cultures and things of that nature that are within our population. Each person, even if we have two 35-year-old individuals at your organization, they're going to have two completely different lifestyles, two completely different needs at the end of the day. So for us as employers to make an assumption as to what they need, I think we're doing them a disservice and doing your overall organization a disservice. So getting an understanding of that. And then secondly, again, as far as knowing your audience, and also you can't control what you can't see. So I've seen a lot of employers Now, I wish I can kind of clone Burt, to be honest with you, because there's so much of this great conversation of starting from the top and really taking control of your health plan. Being out here in California in the beginning parts of my career, it was all about fully insured. Let's just, go pit one carrier against another and see what we can get. And if you're happy if you walk away with a 5 or 7% renewal at the end of the day, but employees are still walking away with higher costs, higher deductibles, and things of that nature. So how much are we really doing at the end of the day to help them be well, right? And so what we've seen, what we're really trying to do is challenge that thinking and challenge that way of kind of creating that health plan, if you will. And again, I'm just going to say it until I'm blue in the face, but you can't control what you can't see. So if we can allow and have employers be at least open to the idea of taking control and customizing a health plan to indeed turn it into a business unit, if you will, then wellness can indeed become what we want it to be overall. If that makes sense.
I mean, I think if there's any takeaway that the advisors and the employers on the call can leave with, I think that was really spot on. I love it. Thank you, Ed. Rachel, what do you got for us?
I have a couple thoughts on this. All right, I got a lot to say about it.
All right, let's settle in.
All right, so this has been my career. I've spent the past 15 years in the well-being industry as a thought leader, as a change agent, and as a contrarian. And I did it in the benefits consulting space, right? I made up my job as a wellness coordinator in 2007 and really got to the point where I was recognized 6 years ago as the #1 health promotion professional in the country and a workforce game changer 2 years ago. And the reason for that isn't because I went along with what the rest of the industry was doing in wellness. It was because I had a different voice and something that was refreshing to people. And so what I want to offer is a few things I want to offer about this. One, I think we do the concept of wellness and well-being a disservice when we limit it to thinking about it in terms of getting people to do stuff. So this idea of, are we fixing, helping, or serving people is how I like to frame it. So a lot of times we think of it as fixing. And there's many things, as you heard in the conversation with Keith and Burt and Eric, right, that we can do to address and save costs, and by improving quality and by improving access and all these different things that are really innovative and effective and proven that work. But I think what we need to do is shift the reason for why we care about this. And the reason why is because when people feel cared for, when people feel like their employer cares about their health and well-being, their mental health and well-being, their social and emotional health and well-being, their advancement in their career, it's expanding wellness to not just be eating broccoli and doing burpees. It's about looking at wellness as this state of wholeness that is characterized by an ability to contribute, the ability to feel connected, and opportunities to grow. Those are the things that contribute. Think about the time in your life, anyone, all of you that are here, where you have felt the most well, where you felt the most vibrant and the most alive. It's not because you were like tracking notches on your water bottle that you drank 10 cups that day. Maybe you were drinking water, but it was probably because you felt a sense of purpose and you felt a sense of meaning. And maybe you were taking care of yourself by exercising and by nourishing yourself. All those things matter to me. I'm a health coach. I mean, this has been my profession, but I really think what we need to do is separate wellness from the conversation around benefits. And it needs to be thought of as, do we as an organization, as an entity, care about the contribution and growth and connection of our people? And what are we doing to demonstrate that by the ways we're inviting them in the conversation, by the way that we're training our leaders? So I'm doing more training, like a lot of what I've been doing over the past years, working with organizations and their leaders and helping them understand how to address and respond to anxiety, how to handle feelings of uncertainty, what that does to your brain, and how it as a leader makes you more reactive. So you're more likely to blow up an employee, and how you can make another choice and do something else, because managers contribute to 70% of the variance in employee engagement. Managers do. And so if we're not looking to leadership and we're not having honest conversations about the way people are leading people, the way people are talking to people, the way they're interacting with each other, if we're not really having conversations with the people that have the greatest influence in the organization, we are missing a tremendous opportunity. And we're putting wellness as that checkbox on the shelf that's a program, as opposed to looking at it as this is an embedded and integrated part of who we are as an organization. And so I would invite anyone here listening to think about expanding your definition of what it means to be well, to move beyond a program, because most wellness programs are frankly an apology for what work has become, which is overly stressful and exhausting for people where they don't feel appreciated or valued. And so I would invite you to think about your career development pathing as part of your wellness initiative, what you do to support people from financial benefits as part of your well-being initiative, what you do for volunteering as part of how you define what it means to care about well-being at the organization. It is an all-encompassing approach, how you tend to people's mental health, which is struggling for so many right now. So I would invite you, and this is, I haven't gotten to have this conversation in a while, so I appreciate you like giving me the space for it. That this is what we need to do if sustainable change is going to happen. We've got to take it off the shelf of being a check the box program that HR is responsible for, and to make it something that is embedded in who we are as an organization and how we treat our people.
Well said.
Drop your
Well,
mic.
I think it goes back
Take it
to
off and drop it.
yeah, that was the ultimate mic drop. But I think to tie it all back in, when we just focus on care and we just focus on career and we just focus on all these isolated pieces, you're not creating that sustainable change. So when people are healthy and they're taking their medication or they're going to better places of care, then they're happier and then their mental health is better and they're more productive at work. So that's what I'm hearing from you, Rachel, right?
It's all connected. It's all integrated. And so we can't. And so I think the important thing is saying, yes, it's a yes and. It's right. Yes, all those things. And we can't minimize wellness to being a check the box program that you have to like get 5,000 points for at the end of the year. It should be embedded in every decision you make. Does this decision enhance and support the well-being of our people, or does this decision diminish the well-being of our people? And if you are asking that question every time before you as an organization make a critical decision, you will end up having healthier, happier people.
Yeah, I agree. So I think, this is a great segue into kind of our last question before a Q&A and some interactive capabilities on this session. So let's talk about tangible. What are some go-to actions and resources to amp engagement now? And this, I'll just kind of go round robin. Let's give the people what they want. Let's give them something they can leave today and be like, yes, I'm going to go back as an advisor, as an employer, and really take some of these nuggets to my next prospect or to my clients. Let's start with you, Eric.
One of the biggest things that we've been implementing for the last few years that has worked incredibly well with small and medium, all the way up to mega size employer groups is text and video. And I'll start with the video. Don't be shy to explain to your C-suite and the HR superheroes that run benefits how powerful their message is and how employees don't need or want to see my ugly face or Ed's ugly face or Andrew's ugly face. Notice I left the ladies out. They don't want to see our face on video. They want to see you as the executive and the HR team. So what I mean by that is something quick, something candid, 45 seconds to a minute. Ask your HR team or your executive, preferably the CEO, CFO, ask them to take out their cell phone, or if you're in person, you can record it for them and do an a selfie video where it's literally, it can be scripted. We have scripts that we send our C-suite, and it's really just, it's 3 parts. It can be more, but it's, hey, employees, it's that time of the year again. We're super fired up. We have incredible benefits. We love you, blah, blah, blah. It's very scripted, talking about open enrollment. It's the beginning. Then there's a middle part where it's a separate video, 45 seconds. Hey, gang, we're halfway through the open enrollment. You guys are the best. We still need 34% of you to get into the Ben admin system and complete yourself. Thank you for your support. Blah, blah, blah. Again, it's scripted. And then a third video goes in when the entire enrollment's done. It can be from the ops person, the corporate executive, the HR, doesn't matter. And it's just a thank you. That's all it is. Hey team, thank you so much. You guys are awesome. We got this open enrollment done in record time, blah, blah, blah. Again, don't worry about fancy lighting like it's a Zoom call. Don't worry about fancy anything. Just have them be genuine. People are so used to these days taking selfie videos with their family. Hi, I'm at Disney World. I'm at the zoo. Like, it's genuine. It's authentic. It comes across real. That C-suite is a real human being. And then what you do with that video, my team, they send it to us and we put captions on it. We make it look a little prettier so it has the ability to be viewed quickly. But ultimately, it's short enough that we can text message it out. Let's remind ourselves, guys, realize that email, it's not dead. We still use email, but there's so many other communication tools that you need to be using. You need to communicate with your employees in multiple languages, by the way. We do so in Spanish and you name it, but communicate with them the way they want to be communicated. The cell phone, the smartphone is the remote control of everybody's life. I have a TV remote control in my hand. It's obsolete. I can use my TV with my cell phone. This is the remote control of everybody's life. Don't underestimate the power of getting a text message. The average text message and video is opened 96% of the time within 5 minutes or less. So I can't share enough. That's such a cool way that I very rarely have a C-suite or an HR tell me, oh, that's a crazy idea. Nobody wants that. It is so remarkably impactful for the employee.
Agreed. Yeah, I love it. And I think John Augustine said it in the chat too. Not only is it better communication and more engagement, but it's a cultural top-down approach to taking a vested interest in employee benefits, which improves engagement. So love it. I'm actually going to go down to Rosario because we lost you for a bit.
You did.
Yeah, good to have you back. What's a go-to tip that will amp engagement now?
I mean, I second everything that Eric just said. He mentioned everything, from texting and video and just sending out. I think it's reaching out. It's, connecting with the employees. It's like Eric said, it could be, just a quick video. But it's reaching out. If you don't know what your employees, if you don't think that text messaging is going to work, try it all. Try text messaging, try, emailing, try, even sending a letter, sending a flyer, mailing something out. Just try it all. But
is it year round? Or do you guys do year round? Or what's the frequency of the outreach?
It's got to be, you have to be proactive and you have to be consistent. So it's got to be year round.
Yeah.
There cannot be just a one-time, because again, just reminders of anything that happened either at open enrollment or at the new hire presentation. Without that consistency, you're going to lose a lot of the engagement with the employees, and then they're not going to feel connected. Getting something, receiving something like a video, like a text message, again, you can just be questions. It could be a survey that you want to send out to see how is the employee, are your employees doing? Are they happy today? Are they, sad? What's, something happening? It doesn't have to be necessarily just about the, benefits and what your message is, but it's reaching out. It's connecting to the employees.
Absolutely.
It's got to be a consistent.
Yeah, I think it's a great reinforcer. Exactly. 100. Ed, what about you?
Eric kind of stole my thunder. I'm not going to lie. He said basically everything I wanted to say. So I'm coming up with something different now. I'm going to make it a little bit more, philosophical. For me, Claude Silver talked a lot about it last Thursday, which was just taking a step back and being humans with one another. I saw, Fernando kind of saying this in the chat as well, and just being people. It doesn't take a title to be human to one another at the end of the day. And so, yes, it does indeed start from the top, because you need that champion from the top to bring it down and have employees feel like they're part of the organization. But I think if we as employers can create a space for employees to, feel valued and feel like they can just be, vulnerable, but at the same time championed, then I think that's also part of that whole person that, Rachel was alluding to earlier as well. So.
Yeah, agreed. And I think to bring it back to benefits, in the communication style, I think the biggest challenge still people don't understand their benefits. There was an article in EBA recently that blew my mind. I was like, how are we in 2021? So to engage, the language that you use in those mediums, I think is important. And that's probably another discussion for another day. But that's what I hear when you talk about being human. It's the way that we talk about healthcare and benefits to make it easier to understand. All right, Rachel, what about you? Tip.
Bring people together. I mean, this is so much of what I've seen and been doing. So I was working with an organization that's actually in the pharmacy benefit space, and doing a series of workshops with them and their employees. We bring them together for 90-minute experiences. And the session was particularly around mindset. So a lot of people were struggling with that. And so to bring people together to go through different choreographies of the small group conversations that are very pointed, that are very structured, and getting them, one of the main pieces of feedback we got was that their favorite part of the whole experience is the opportunities to interact with each other and not talk about work. Like, people are craving connection right now. They miss seeing each other. And so having the opportunity to get together and be with each other and talk about something that doesn't have to do with work, where they can just, to Ed's point, right, be human with each other, has been really powerful. And then a tangible outcome from that, I just connected with the HR director this week, and we have another session next week. And I just asked, so any follow-up, from the session we just did? She said, actually, one of the goals of doing that session was to remind people and encourage them to take vacation. And so we had them do an exercise of imagining a 4-hour vacation. What would they do with 4 hours of time? And she said, the cool thing that happened was that, like, right after that session, we noticed a spike in the amount of people that were requesting time off. And some people specifically said, I'm doing this because of that workshop. So they're like, it worked. And so it's really cool. What can happen is if you get people into conversation, and again, like there's an art and a science. When facilitation looks easy, that means it's being done really well, but there's a lot that goes into doing it effectively. And so that's what I found to be really effective, is getting people in conversation, getting them sharing stories, getting them sharing what's working for you. If organizations just did that, what's working for you regarding benefits, what's working regarding communication, what's working regarding taking care of yourself, what's working regarding working from home, right? Like, if people just had conversations with each other and tallied that and captured that insight, and then came back together and said, okay, this is what's working. And then where do you feel stuck? Where do you need more support? And inviting people to share those things. And then here's the key thing, acting on it. It's one thing to collect a bunch of data and information. You're better off to not ask people for their opinion at all if you're actually not going to act on it. You're much better off to have the intention set up on the front end that we're going to take action on this. We have a plan for how we're going to take action on this on the back end. So those are some things that I would suggest.
Excellent. Thank you. All right. And we'll round it out with Andrew. What's your tip to amp engagement now?
Awesome. Well, I'm going to go back to what Eric and Rosario talked about with video and text messages, and really any platform that is unique and different that people want to be communicated on. Eric gave the text stat 96%. It's actually 98% within the first 90 seconds that somebody opens a text message. So we have clients with text message platforms right now that use them. They send out surveys once a week. They send out reminders. They send out holiday greetings as a way to really get the engagement set with their population. They're spread out all over San Francisco. And what was happening before they did that was they were taking from the C-suite, they were communicating to the managers, and the managers were putting out the information onto the street level, so to speak. And my comment to them was, so you're essentially playing a game of telephone, because what you are saying here, when it goes through the manager, is not going to be communicated or not heard the same way as when you originally put it out. So text messaging is a huge deal. Not a lot of companies have embraced it. Many have, but not many. And also the videos, Rosario and I have Benefits TV, and that's something that we've been hitting on the last couple of years, and dropping bite-sized benefits information to employees. There was a stat that came out recently that said that just under 50% of employees feel more engaged when they receive information in video rather than through written word. And I know that's certainly true with me, and I think that's probably true with others as well, especially as the workforce gets younger. So really, those two things is a way to communicate with your employees. I think you can't go wrong once it comes to employee engagement.
Yeah, and I think if we're talking about change, we're talking about making change, the communication is the piece. So I think that you guys reinforcing and emphasizing that is a big piece in taking the knowledge that you're hearing today and then actually putting it into practicality. If you're talking about change with your clients, have a plan in place so that you can actually strategically make the change so that you have the outcomes. I think that's what it's really all about. Okay, so we have 1 minute left, and we want to thank everyone for being here. In the chat, let's drop what's something you're going to do with this information. What did you get out of the session? Let's get our ideas out there so other people can benefit from your takeaways. Let's get the party started in the chat real quick. I'm going to drop Are we dropping the link, Rachel, or no? We're just going to put it in the chat.
Yeah, if y'all can just drop in. What was your key takeaway or insight today? Something that you heard today that you're like, I'm going to carry that with me, or an action step that you're going to take as a result of being here. And then because Jervis asked, I will do a little ditty in a second. But,
all right.
Okay.
So what are some action steps?
Jervis, I'll let the action steps come in and then I'll sing you just a little. Is he still here? I had to hop off.
No, he had to leave.
He had to leave. That's a bummer.
All right.
Act on the survey results
on LinkedIn.
Yep.
Great. So let's see. Great ways to communicate better, Robbie says. Jay, text videos to employees, a great idea. Michael, act on survey results. Yes, don't ask if you're not going to act. Keith, videos. Yes, think of yourself and what you watch and don't watch. Everything in digestible nuggets and small bites. Absolutely. Jay, thanks for joining us. Anything else? Key takeaway, insights, something that made you think differently. Yeah, Megan says you're not captive to a fully insured employer. Burt had mentioned that. Yeah, so being creative and strategic with how you're approaching how you're structuring, right, your funding. Thank you. Awesome. Carolyn, thanks for being here. Lindsay, yes, wellness needs to be embedded in the organization, not a checkbox. Yes, and not a water bottle contest either. Michael, year-round communication to educate. Great discussion. Thanks, everyone. Yeah, CFOs want control. They do, and we want to give them tools for how to have that, so that they feel a sense of being able to control costs. Great.
All right. Well, we're at 1 minute after. Rachel, take us out, like with that beautiful voice that you captivate all of LinkedIn with.
Okay. Well, I'll do this. I was going to sing this for Jervis. I'll sing it separately. This is a song that just makes me happy. By the way, singing activates the calming branch of your nervous system. So even if you suck at singing, your body and mental health benefit from singing, humming, and chanting. Sidebar. So if somebody at your house yells at you for that later, you can blame me. So one of my favorite songs for my husband's favorite Disney movie. Okay. Hakuna Matata, what a wonderful phrase. Hakuna Matata, ain't no passing craze. It means no worries for the rest of your days. It's our problem-free philosophy. Hakuna Matata. There we go. So thank you. We'll see you next Thursday where we talk about the community element of this and we wrap it all up. Thank you all so much. It is part of my current profession. So thank you for that. Feel free to connect with all of us and WellNet on LinkedIn. If y'all want to drop your LinkedIn's in there, you can. But Eric, Ed, Andrew, Megan, Keith, Rosario, fantastic. Thank you all so much again. And we will see you next week and kick it back over to Tina.
All right. Thank you, guys.
Thank you, everybody.